exactly is postpartum depression?
Postpartum depression is depression symptoms that occur after delivery of baby. These are usually much more pervasive, more severe symptoms. It's very common to see baby blues in a good 60 to 75% of patients after they deliver. Now, those symptoms are usually mild to moderate and usually go away within a few weeks. But as for postpartum depression, that's a lot more severe, persistent, pervasive symptoms that affect mom and the whole family unit, really.
Okay, so what would you say is like the prevalence of it? How often do you see cases?
Yeah, prevalence, it's somewhere between about 10 and 16% or so.
Okay.
And the reality is that depression is often very much underdiagnosed before delivery. Even there's a lot of women who have depression symptoms during pregnancy, and also those can definitely manifest themselves after delivery as their mental thresholds can be affected by taking care of a new baby and the stresses of being a mom.
Yeah. Are there any testing or like screening that you as doctors do with all your patients during or after the pregnancy to check for postpartum depression?
We recommend universal screening for all of our patients. When we think of screening, we often think of tests or forms they need to fill out to assess these risks, but the reality is having an open conversation about mental health with patients is something we really want to strive for.
Yeah.
Mental health is a very real disease just as much as diabetes or hypertension is. It is, the brain is an organ just as much as the kidney, the liver, or gallbladder are, and it is susceptible to disease.
Okay.
And so screening for that, having an open conversation about patients about, hey, this is reality. This is something that can absolutely affect not just your mental health, but your physical health, your emotional well-being, and your family life as well too. And so yeah, we definitely do assess for that throughout the pregnancy. There are several risk factors as well that can put a woman at increased risk for postpartum depression. Those who may have higher risk pregnancies, those who have twins or triplets, so to speak, or those who have pregnancies that may not go as planned. They are at high risk, and we definitely need to be looking out closely for them. But there are several objective measurements that we can do to test for their risk for depression. There's the Beck inventory, the CAD-7. There's other ones like the PHQ-10 or SIGI caps. There's a lot of things that we kind of can assess kind of on paper to see what their risks are for mild, moderate, or severe depression.
Okay.
If they're excessively sleepy or they can't sleep at all at nights. Interest, if they just don't have any desire to get out and be with people, or they just lose interest in things that would usually make them happy. Next is guilt, feeling excessive guilt about how they are as a mom or how they are as a spouse, or just who they are as a person is definitely concerning. Their energy level, which again as a new mom is very difficult to maintain, but if they're just feel like they're just dragging and can't get through the day, that's definitely a concern. Their appetite, if they're feeling excessive appetite or no appetite at all. And then psychomotor agitation is another part of there, which is that concern of just being on edge all the time or very irritable and angry. And then one that we're always concerned about is last is suicidality, or feelings or thoughts or desire to harm themselves.
So what's the best treatment option for someone?
Being able to have an open conversation about your mental health is always the most important place to start. Having family members and neighbors and friends who are supportive and willing to talk with them is very helpful. Usually one of the first treatments that we would start after delivery is that of referring to a therapist or a specialist in mental health to learn some techniques to cope. We do have some excellent healthcare practitioners in town who provide this on a daily basis, and I do highly recommend them. There are other times where medication is just as important and just as helpful for mom and especially for baby. These medications can come through placenta, can come through the breast milk, but the amount that it affects baby is minimal. And
Are there any preventative measures someone can take to avoid this?
I think one of the best preventions is that open communication about mental health. It needs to be something that's a lot more accepted in the community and in health care in general. When I see my patients for the first time, what I want to tell them is, you're going to tell me about your contractions, you're going to tell me about any random symptom during pregnancy. Please tell me about your mental health symptoms as well too.
Yeah, because it's just as important. Yeah.
Exactly. I need you to let me know about this, because if, the reality is not everyone has every risk factor that is out there to lead to postpartum depression. That doesn't mean that it's not going to happen. All the others, exercising, eating well, eating healthy. It's amazing that when we nourish our body well, how well it functions.
Yeah.
Now that we have the technology that we do, we often find ourselves just sitting on the couch looking at our phones instead of actually challenging our brains and keeping them active. And hobbies and extracurricular activities are fantastic ways to keep our mind active, and can definitely help with our threshold for depression. Yeah, having said all that, if you do have concerns for depression or anxiety, it's very important to be evaluated by who does provide that, so that you can get the appropriate treatment and resources if that is needed.